Hello, hello, everyone. Hi, my name is Jennifer Waters, and I am one of the acupuncturists and healthcare practitioners at CNY Fertility and CNY Healing Arts. And I've been in private practice now for, oh my gosh, almost 25 years. I didn't think I was going to be live. I'm supposed to be not live. Anyways, I'm just going to dive right in. Oh, wow. I guess I am live. I'm supposed to be recording this for, oh, geez. I hope I'm not barging in on anyone else's time. Anyways, I had scheduled this to be tomorrow morning, my usual time. Oh, you did? Yeah. I'm sorry, ladies. I'm coughing. Not coughing, I'm choking. The reason that I've become very interested in what we can do to support you is because almost everybody I talk to in the fertility world has endometriosis or PCOS. So this is an epidemic. Back in the day when I went to acupuncture school in 1994, we never talked about it. I don't ever remember it as a subject now, and now it is. And so I've done a pretty deep dive into, my main interest in health and healing is how can we accelerate the healing process? What can we do to accelerate the body to do what it was designed to do? We are um amazingly designed to heal ourselves. If anybody ever tells you, "Oh, I'm a healer and I'm going to heal you," run. Don't go to them. It's not how it works. I can't heal you. I can provide you with information, with tools, with support, with enthusiasm for you to heal yourself. Okay? And so that's all that we can do. And I think it's a big problem with our medical world now is people have lost patients have lost their ability to think for themselves. They've lost their purse feeling empowered, and they are relying on external sources to tell them what's going on with them. Anybody that's met me in the clinic knows I always ask, what do you think caused your endometriosis? Rarely. Sometimes people say genetics, and I do think there can be a genetic component, especially when you see it. My aunts, my sisters, my mother all have it. That's fine. But just because you have the gene doesn't mean that is your fate. Okay. Something has to turn the gene on for it to become that. All right. So we can influence our genetics. This is epigenetics, right? We know that now. This is old news. There's lots of work. Dr. Bruce Lipton is my favorite one that wrote The Biology of Belief, and how what we're believing, what we're feeling, what we're thinking is absolutely influencing how our cells are functioning. Okay, so some little known facts about endometriosis. First of all, when I started a deep dive into this years ago, thinking about it through the Arvigo world, it was not considered an autoimmune disease, and now it is. And so I've talked about this before, Stephanie. That is the $1 million question. We're going to talk about that in a minute. So I just did a quick Google search to see if what's coming up on Google in terms of is endometriosis autoimmune or not. And it was really funny. The main article that came up, they were doing a study of the studies to see if it was basically present in women that had other autoimmune conditions, which is really seems for me like a waste of time, like, okay, we're going to study the studies. So what? Who cares? Let's get to what is a possible causation. How are we defining autoimmune, and what can we do about it? Okay. Can we possibly just get to the end of the story? So, Stephanie, it's different for everybody, right? Number one thing you want to look at is location of the uterus. I believe the reason why endometriosis is so prevalent is because the uterus is a fairly vulnerable organ. Okay. Listen, the pituitary gland, if we're thinking about the endocrine system, the pituitary gland, basically all it has to do, it has an important role in our hormonal balance, but all it has to do is pulse. pulse. It has to be supported, but it's protected in there, right? If it doesn't get enough light, it's going to be under functioning. So we give it some light and then it's happy again. The uterus has to do a lot, right? So every month goes through big changes, right? Almost doubles in size, receives all of the blood, which is affected by how well the liver's functioning, how is the spleen functioning, and then it has to shed this lining, right? So that's a big recruit, right? All the while, um, she is suspended by ligaments, right? So, like I've said a million times before, one fall on the ice when you're 9 years old, boom, your uterus is out of location. Now you're setting yourself up for a problem later on because this endometrial tissue is not going to have an easy time flushing out of the uterus, right? So it's more likely the old endometrium is growing on top of the new. And then what happens is you get that brown discharge and it will start pushing out of the uterus, right? So the first thing to do is look at location, ask anytime you're getting an ultrasound, hey, is my uterus in a good position, proper alignment? Oh, we don't care about that. Well, care about it. You're the patient. Ask. Well, I'm just curious. It's my body, right? My body, myself, I'd like to know what's going on because there must be something going on if I have this diagnosis. If you get menstrual cramps in your lower back, chances are your uterus is retroflexed, right? So you need to find an RV-go therapist that can help push her, nudge her, encourage her, invite her into a better position. So that's the first thing, structural. Location, location. You can think of your uterus for a moment as like a condominium because it is. Every month, waiting to see if a new tenant's going to move in, right? And some months, like, whoo, not this month. Yay, we don't have to worry about that job. Other months, it's like, oh, we really were ready. And now we wish somebody was moving in now. So this is a lot of energy, a lot that's going on there. For those of you that are taking hormonal birth control and you're not shedding your lining, I believe this is putting you at a disadvantage. We diagnose through the menstrual blood. Are you getting clots? This is telling us something is going on with your liver. This is part of the pattern of endometriosis. You need to look at the quality of blood. Is it clotty? Is it light? Is it dark? Is it brown? Okay, so this is one of our diagnostic tools. In the olden days, that's what we had, right? We had the body fluids to tell us, to show us how well things are functioning inside. Okay. So, Stephanie, mine was on my ovary fossa and at the end of my tube closest to the uterus. Yeah, yeah. I mean, let's hope it's only there. I mean, here's the thing, once it gets outside of your uterus, it can go anywhere. But here's a fact that I bet you don't know, and I just became aware of it recently through my studies. What is the one organ in the body that they have never found endometriosis? Does anybody know? I had surgery to remove stage 4, and it was on, oh dear, I'm sorry, Doreen. Yes, it's very intense. So, in my deeper dive a couple weeks ago, I was reading about this, and one of my teachers said they have never found. No, you can find endometriosis in the brain, in the lungs, everywhere, right? It travels through the body, through your lymphatics and your cardiovascular system. So they've never found endometriosis on the spleen. And I had such bad tumors. They were 12 pounds. Oh dear. Yeah, left ovary and your left ovary. As long as they left your right ovary, it's okay. We can support your right ovary to secrete the hormones that it needs. There's a lot of things that we can do. So, Josie, after surgery, this is where we want to get to work, okay? And say, okay, fine. That's the past. It's over now. You did the surgery. It was obviously necessary. Now let's give the body what it needs, right? So you've got to look at the structure of your uterus. You've got to look at the location, and then we have to start treating the cause. So if we find out that if we now know one of the facts, they have never found endometriosis on the spleen itself. What does that tell us? That's like it's amazing. It's a bit of a miracle. So now we know that the spleen is the cure, right? So, supporting the spleen in Chinese medicine, now we're talking about channel theory here. The spleen channel is what holds things in their place. It holds the blood in the vessels. Are you bruising easy? Do you have loose stools? Do you have hemorrhoids? Do you have varicose veins? Things like that show us that you have a weak spleen. You need to strengthen your spleen. Endometriosis would be an extreme case of a weak spleen. There is a loss of cellular integrity, a loss of integrity in the tissue that has allowed the endometrium to push out. So let's say your uterus is in a perfect location, everything's fine structurally, that is not the issue. Then we know it's the spleen, and most likely the liver is involved. During We don't really need to do specific tests for it. Any Chinese medicine practitioner should be able to give you this information. Listen, a lot of you are already working with acupuncturists and herbalists. That's wonderful. I highly recommend it. Please get a diagnosis from them. Okay. We went to school, we were trained to do a differential diagnosis. I want you to know what you're working on, because working on something like strengthening your spleen, it happens all the time. There's so many things that you can do that are non-supplement approaches, whether it's color therapy or sound or foods that you're going to be eating or knowing what to avoid or the emotional aspect. The spleen is very influenced by overthinking, worry, and rumination. So having a 10 to 20 minute a day meditation practice is definitely going to help you to strengthen that organ meridian system. Stephanie, how much can endometriosis affect one's AMH? Good question. I mean, if it's on your ovaries, it's definitely going to, right? And yours was. So absolutely, the ovarian tissue, just like the thyroid tissue, is very, very sensitive. So it doesn't take much to influence things. So, but remember, we have a lot of solutions. We have a lot of good things to help you. So the treatment protocol, if you were to come to see myself or another practitioner, obviously we would do the Arvigo work. We would be looking at getting the blood flow back and the strength and the nourishment that those ligaments need to hold your uterus in proper position. And then we would look at, if you don't remember that you had a fall on the ice, or you were a ballerina and you fell a lot, or whatever, you did a lot of horseback riding, then we have to look at your posture. Do you wear high heels? Wearing high heels will throw your pelvis out of alignment, and that definitely impacts the ligaments being overstretched and how well supported your uterus is. So we would take a look at that. And then I would absolutely put you on a protocol that would include supporting the spleen, and you will get very good results. So we want to strengthen the spleen to hold the blood in, and we want to support the liver so that the blood is flowing smoothly. Most of the medication that's out, no, I would say all of the pharmaceutical interventions that are for endometriosis are only for what? They're only for treating the pain, right? So I've talked to some of the drug reps, very nice people, wonderful, smart, hardworking. And I said, okay, well, what's the cause? They don't know. It's idiopathic. Oh, geez. Okay, fine. What's the cure? Oh, there's no cure. All we want to do is deaden the pain. Okay, folks. Wow, really? That's it? Let's step it up. Okay, let's take a few steps in the direction of healing the body. We are designed, this is not a sentence, especially if you are getting ready for a transfer. Stephanie, I want you to reach out to me and I will send you the protocol. Okay. Email me from my website, jenniferwaters.net, and we'll go over that. I'll email it to you, probably not today, maybe tonight or tomorrow. So yes, it's my pleasure. It is my pleasure. So back to my original question, the little known facts about endometriosis, is it autoimmune or not? Does it really matter? I mean, I guess it depends on how you define autoimmune. So, for a long time, I've been saying the body does not attack itself. You would not start attacking yourself. Even if you really hated yourself, I guess you could. Self hatred, we could think of. I like to think of antigens in a broader definition, not just toxins or endogenous hormones that are going to be harmful or viruses or bacteria, but like scar tissue. In a way, we could think of scar tissue as an antigen because it sets up a weakening of the tissue that allows the auto antibodies out of the cell nucleus and into the blood where they should not be, right? So I'm going to be talking more about this, really how we can start looking at autoimmunity as not a standalone disease, but actually a late stage result of chronic deterioration from a lack of nutrition, from multiple surgeries, from, could be Epstein-Barr virus, could be other bacteria, right? So it means that the body has not had what it's needed for a long time to win the battle, and it's lost the battle. And now you've got a diagnosis of autoimmune disease. And a lot of people just live with this, and then they punish their immune system by saying, you're overreacting here. No, 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 no. The immune system is doing what it was designed to do. We need to remove the inhibition. We need to remove why the immune system is acting this way, and then say thank you to the immune system for doing what it is designed to do, create a decoy for the immune system to go after that, and then simply give the glands what they need from a nutritional point of view to heal and repair themselves. Okay. I don't believe that inflammation, again, is a standalone thing. I think that inflammation is a result of degeneration. The body starts breaking down. Why? Like I said, chronic stress, lack of nutrition, heavy metal toxicity, other things we've been exposed to or not supposed to. And then the body starts losing the battle. Okay. So, there's a lot of things that you can do. This is what I say, it's what you do every day that matters most, which is how we end up winning the battle, right? You don't want to just go eat one good meal a week or a month. You want to try to have 3 a day or 2 a day or something every day. Okay. So, so yes, I believe endometriosis is autoimmune. It's because the uterus has lost its ability to win the battle. Why? Because the spleen is weak. Why? Lots of reasons. Bad diet, chronic stress, eating on the run, eating cold food, drinking too much ice in the morning, overthinking, worry, rumination. Some people have an attack to the spleen. If you've been in a car accident and your seatbelt is there, sometimes it can be a physical um, something, disruption. But the spleen is very influenced by what we're thinking and what we're eating and how we respond to stress. So all of that accumulates, and then boom, of course, it's going to be affecting your weak link, which really for all women, the uterus is the reproductive system is the weak link. Like I said before, because we're recruiting it, it is being recruited all of the time. The endocrine system is very sensitive. And I think once it goes awry, it's a little harder to write the course. And unfortunately, endocrinologists generally are just looking at one gland. Oh, we'll just put you on thyroid medication. Well, if your thyroid is off, your ovaries are off. And if your ovaries and thyroid is off, probably your pituitary is off and your hypothalamus. So, could we possibly just kind of reset the entire endocrine system? Let's do that. We've got some really good, and this should not be expensive. This should not take years and years. This should be fairly easy to do, and this should be something that you feel the benefits of soon, either right away or within the first 3 months. So, whoever you're working with, we'd like to see results within 3 months, especially if you're getting ready for another transfer or retrieval. Our ovaries need a lot of support. Okay, everybody, I think that's enough of me ranting on for today. Thank you for your interest in health and improving your health. Helping you is helping myself and helping everyone. So please remember to be kind to yourselves and everyone you run into today. All right. Thank you. Bye.